My name is Yoshihiro Kotsubo. I am an owner and the general manager of a dental implant specialized clinic in Fukuoka. I have graduated the Fukuoka Dental College. I am very happy to have this opportunity to come to your lovely country for the third time this year to make another presentation. I feel honored to be here again. We have 20 minutes for my presentation. I will be talking about implant-supported denture. Since we don't have much time, I explain about the slide briefly. Japan is becoming an aging society. The ratio of people who are over 65 years will reach 20% in a few years. In 2050, the ratio is projected to reach 32%. Here in Korea, the birth rate is declining faster than Japan. So, our main future clients will be senior citizens. Their jaws are not strong enough for dentures. Therefore, the best treatment for them is implant-supported denture. In our study, we created implant-retained complete dentures. The subjects were dangerous patients in their 50s and 70s. We used the bar system and magnet system as retainers, and we examined the characteristics of each system. Implants have been effective retainers which increase the stability of dentures and mastication efficiency. They have also improved the quality of life of patients. There are a number of retainers. However, the bar system and magnet system provide relatively high stability compared to others. I would like to present a summary and the use of these systems in a few cases in our study and examine each system. Number one, I would like to share with you 5 different special clinical cases I had recently regarding to implant-supported denture. Natural teeth number 4 and 5 at the upper right remain in place, and bone resorption is advanced in the mandibular posterior region. So, 4 implants are placed in the anterior region. Teeth number 4 and 5 are scheduled for extraction because of root fracture. The lower front dentures that the patient had been using were unstable, and the mucosa were damaged. The implants should be placed as evenly as possible, starting at the midline. The mucosa are sutured around the healing cap to promote the development of keratized gingiva. After treatment, an abutment is fitted for the bar system. Attach transfer pins to abutments to take an impression for header bar. This slide shows a header bar making process. After attaching the header bar, the undercuts beneath the bar were brought out, and spacers were placed for the clips. The upper and lower dentures are manufactured. Clips were placed on the teeth side of the denture. Case number 2. In this case, we inserted a symmetrical implant in the mandible. We consider this case as an ideal. This right. Initial examination. There is a little bone resorption in the mandibular posterior region. So, implant placement is possible. Implants are placed so that they are balanced on the left and right side. After screwing keepers, put magnets on them. The magnets are placed on the teeth side of the denture. A keeper was placed on the implant body. Magnets were placed onto the teeth side of the denture. It was accomplished easily without undercuts. It is important that implants should be given relief around it because it can secure clearance between implant and denture. Three types keeper are prepared depending on the thickness of the mucosa. At the final denture placement, placing implants in the posterior region as well make it possible to achieve a very stable denture arrangement. When using magnets, try to keep the incline of the implant body less than 30 degrees to secure the maximum retention. The maxilla was stabilized with the stabilization of the mandibular denture. There are several ways of fixture. I have decided that for fixture in the arch is the best. Inserting implant into tooth number 3 and 6. Please look at this slide. The gap between implants is not enough. In this slide, the gap is much bigger. In our third case, 4 implants is performed in the posterior region of the maxilla. A flabby ridge was observed in the maxillary anterior region. A 2-stage implant is performed in the posterior region on the left side using the split crest technique. We deduce the alveolar crest and an implant hole was made vertically with the bone. The root form implant was seeded by self-tapping. The gap is filled with bone graft material. After the secondary operation, an impression is taken and the cadaver is made. After attaching the cadaver, The undercut beneath the bar were blocked out. Clips were placed on the header bar. Clips were placed on the this side of the denture. Post-operative frontal view, denture stability was achieved. The clients got a denture not only aesthetic but also functional.